Hello, welcome to North Alabama Medical Center. We want to show you the layout of our patient rooms in the new hospital because it's really important that we keep the rooms looking exactly the same. First off, I would point out this is the patient's room number sign. The sequence of rooms is very logical as compared to ECM where you never could figure out where the room numbers were. And that they have these small pullouts here. So the patient is, for example, on daily waits, you don't need to put a sign on the door. You basically just pull this and that lets us know the patient is on daily waits. If the patient is in isolation, you don't put a sign on the door. You just slip this right into here and we know the patient's in isolation. All your PPE stuff is in the closet, no need for an isolation cart. The theme here is that we do not want to put anything on the door. Can I stress that enough? I'm speaking for Mike Howard too as well. Come on in. So we were really methodological about trying to be very precise about where everything went so that in all 263 rooms there could be some standards. So when you first thing walk in, you will find the alcohol-based hand gel. Different than the old one. The old ones, you could stick your hand like this and you would get showered. This one is a motion active. You have to push it. Above this is the Westcom nurse call system. That allows the nurse to identify that she's in the room. It also identifies when the patient is leaving. We just press that button. It lets the nurse in the entire system, including environmental services, know this room is now empty and ready for clean. So every room has glove holders. At ECM, there were sometimes 2 or 3 glove holders, sometimes 1. They were all different parts of the room. Every room is the same. They're here every single time, and one for small, medium, and large. We were very painstaking about how we organize the sink because there'll be a lot of activity. Basically, a lot of staff washing their hands here. Every sink has a trash can. The trash can doesn't go like this, that sticks like this. It goes like this, so it's a clean line. Same thing in every room, and then come on in. So behind the door, we have a shelf system. We've not really defined everything that's going to be on the shelf, but let me tell you what's not on the shelf. 8 pounds of linen for when the patient might use the bathroom or might need to have a bed change. A few linens if the patient needs something like for a bath or a shower is great. And then patients can put their own stuff here as well, okay? The patients also have this, which is a nice flower shelf. And then below here is where they can hang up all their clothes that they're going to walk home with. The room is organized into 3 zones. So this is the nurse zone, this is the patient zone, and of course this is the family zone. The nurse zone is designed so that when she comes in, most often her IVs will be on this side of the bed, and then her needle box is right here so that she can immediately dispose of sharps and decrease our chance of needle sticks. And then right here is trash. So the trash can doesn't go here, it goes right here, right underneath this. When the room is clean, these should be pulled all the way back so they're not seen when you first walk into the room. If you'll notice, the bed now has a colored blanket on it. All of the inpatient rooms will have colored blankets on them, and so this is how the typical bed will look when it's fresh and made for the next patient. The bed has a bed exit system, a nurse call system, but it also has a light function in here, so the lights can be turned on and off from this site. And this, of course, is a very big light for doing a medical procedure examination. This is a night light. That night light stays on for now. So this is the patient's bed. We have all new overbed tables that roll and are really pretty simple and easy. We've got a lot of positive feedback from this. We have these throughout the entire hospital. Finishing on down the room, if we're going to go to the back wall, this is the patient's communication board. Communication board is bought, we spend a lot of money on these communication boards because we know that this is best practice for patients to interact with the nurse and interact around the communication board. So this is where, for example, when nurses come in to give bedside shift report or they change a shift, that they would be doing it right here, maybe updating the board and engaging the patient as possible. And this is where if I'm leaving for the day and Melissa's coming on, I would talk to the nurse and say, this is Melissa, she's one of our nurses, she's been here for 14 years, she's a great nurse, you're gonna love working for her. And so we help Melissa get a better start to her day. Of course, TV right here. And then of course, every room has a folding chair. That chair is really designed for the medical staff so that when they come in to have a conversation with the patient, they can sit down and have an eye-to-eye conversation. Research shows that sitting down and having a conversation with a person makes them feel like the conversation was twice as long as it really was. So this is the recliner. Every room has a recliner. If you'll note, the recliner is on this side of the zone and not on that side of the zone. So we're not going to change this around from time to time. This couch will always go here. It makes a bed very easily if needed, and patients and families can store things down here as well. This is not a place where we stuff linen. Got it? Of course, the bed is locked when it's in use, and the windows have two features I will point out to you. Sometimes we might hit some high sun, and so if that happens, we have darkening shades. And if you just want a little protection from the sun, you can use the lighter shade. So very nice in all the rooms. Every room has a clock, and I think that finishes, except for the bathroom, our tour. One of the things that's nice about the bathrooms in North Alabama is they're big. The bathrooms at ECM were very, very small and tiny. It was almost impossible to get the nurse and the patient in the room together. And so every room has now a shower. Every shower has a shower chair so the patient can sit down. There is a alarm if the patient needs help from the shower, and also one from the toilet. Every bathroom now has a linen cart. If you'll remember at ECM, one of our nasty practices that we want to break is piling up linen on the floor. Well, there's no need, of course, ever to do that again because dirty linen will go in here. The linen hamper does not stay out in the room. You can take it out in the room if you need to use it, but when it's finished, it needs to come back right back to this location. Please empty your linen when it gets in full, or if there's anything in there that has a rancid odor, because we want to get rid of that. And that does conclude the tour. Thank you for listening. Thank you for paying attention to the room setup, because it's very important that our look be consistent so we improve our patient satisfaction scores. Thank you all very much. Have a great day.